My name is Kirby Brady. I am your moderator today. Thank you for joining us for today's session, Measuring Poverty and Economic Wellbeing with ACS Data. I am joined today by our guests, Doug Everett from the National Center for Education Statistics, as well as Liana Fox and Brian Glassman from the Census Bureau and the Minnesota Population Center, as well as Lisa Manzer and Karen Seeger for the Center for Women's Welfare. And we are excited to get started today. So just a few housekeeping items before we get started. We will be asking for you to use the Q&A function in the attendee hub. This will allow you to submit questions to us. You can submit anonymously if you'd like. We will be holding all of those questions until the conclusion of the session. So we'll let all of the speakers present, and then we'll be giving them the time after they've finished to answer those questions. So I will be asking for our first guest, Doug Everett, to go ahead and kick us off for today's session.
And hopefully you can see the slides. Good afternoon. I'm Doug Everett. I lead the Education, Demographic, Geographic, and Economic Statistics program at NCES. I work with May and Javier and other members of the Census Bureau's EDGE branch in the Economic Reimbursable Surveys division to develop custom data products for the Department of Education. Look forward to telling you a little bit about some of the neighborhood poverty work that we're doing. Before I do that, let me offer the standard caveat that these are my own views. They don't necessarily represent the official views of NCES, the Census Bureau, or anybody else. With that ado, this work is part of what we refer to as the side project. NCES initiated it a while ago because we need another way to identify school poverty. Data users in the education space typically use counts of students who are eligible for free and reduced price lunches to identify high poverty schools. But those data have become less reliable over time due to a variety of issues. So we were looking for a way to leverage ACS data to provide some additional clarity about local neighborhood level economic conditions. We call it the side project, partly because we never have enough time to work on it as much as we would like, but also partly because it's an odd juxtaposition of applying spatial interpolation methods to a demographic or a socioeconomic problem. So we ended up pursuing an unusual route because of some unusual design requirements that we had. First of all, we needed a flexible neighborhood definition that could be anchored or centered at specific locations. We didn't want to be tied down to using census tract boundaries as proxy neighborhoods just because they were small and they had data available. We also needed the highly local estimates that were reasonably reliable. I mean, ideally, we'd want something that was, about the size of a block group, but had the estimate of a census tract or better. And if we could pull that off, well, third, most importantly, maybe, we need to make sure that it's safe. Right, we got to make sure that there is no risk to disclosure whatsoever. A tall order. If we can do all of that, then we certainly would want to update it every year. So we also need a design solution that would play nicely in our current production environment. That's a tough puzzle to solve, and we're still in the process of solving it. But we eventually came up with a design solution that has three primary components. The first is that instead of defining neighborhoods based on fixed geographic areas, we define neighborhoods as a collection of nearest neighbors. There are lots of reasons for doing that, but the primary upside is that if we adopt that kind of conceptual approach, we can reframe the problem as a neighbor-based puzzle, and then we can borrow geostatistical techniques to produce estimates based on information from nearest neighbors. The second part of the solution applies a unique Kriging model to ACS 5-year sample responses to develop a continuous prediction surface of the income to poverty ratio. So think of the results more like a weather map, except instead of trying to predict snowfall in specific locations, we're predicting income, or the income to poverty ratio. If you're familiar with the IPR, it ranges from 0 to a top coded value of 999. It's a nice distribution. A value of 100 is equal to the poverty income threshold. You've got 100% of the poverty income. So a value of 200 is twice the poverty income level. So the end result of this exercise is a prediction surface that models the underlying microdata and provides an optimized IPR estimate for any point location on that surface. So it's not constrained by census geography. In fact, it doesn't use census boundaries at all. It's a different type of estimation approach. So lastly, we create a rasterized version of that IPR prediction surface that can then be exported to NCES and used to help assign poverty estimates to student address geocodes. So again, it's a three-part strategy, but it centers on a geostatistical approach. So just to be clear, we are not spatial statisticians. We just happen to have a design puzzle where spatial methods provided the best solution to meet our analytic needs. For those of you who aren't familiar with kriging, it's a geostatistical technique that uses information from measured or sampled locations to help you predict values at unmeasured locations. And it uses information about the overall spatial structure inherent in your data to help optimize those predictions. So the more spatial autocorrelation you have in your data, the more benefit kriging will provide. Spatial statisticians sometimes say that kriging uses the data twice, partly because it relies on two different stages of modeling. The goal of the first stage is to interrogate the data and explore the relationship between the distance of measured points and the difference in their income responses. So it considers that relationship across all possible pairs in your data, and then it models a semi-variogram to find a covariance function that quantifies that relationship. So kind of hold that here. The second stage of the modeling process identifies a specific set of sampled cases that are nearest to the unmeasured location that you want to predict. Once it identifies them, it's going to run back and find, essentially create weights using the model exercise it did in stage one, and it's going to apply optimized weights to each one of those neighbors. So stage one essentially models the data to learn about it. Stage two models the data to create the assignment, but it's going to borrow information from stage one that it learns. So one of the key challenges in all of that in a standard kriging model is that it assumes that relationship between distance and difference is consistent over an entire study area. And in a large study area, that assumption gets violated. So empirical Bayesian kriging is a relatively recent addition to the kriging family that develops and blends a large collection of local models to help address that problem of non-stationarity. So instead of only modeling or creating one model in that first stage, it creates a big collection of models. You can have thousands of localized models that are allow for more sensitivity to local conditions. So let me give you an example of what this looks like. See how I'm doing on time. So again, our first step is to model the income responses from ACS households with school-age children. That creates a continuous prediction surface, but since that surface only lives in the server memory and it's really just a big collection of models, it's, I guess, estimates in potentia, we can't really show a picture of that full fidelity version. I guess if you squint here, you can blur some of these pixels and get a better feel for what that might look like inside the server. But ultimately, we're going through that model process to figure out what those spatial relationships are in the data. Now, let's say that we want to predict an IPR value for a specific location. Like this point here in the middle of the screen. The next step of the modeling process is going to find and use information from the nearest neighbors. I'm going to show you a map next. It's going to have points on it that look like household locations. They are not real. They are not real. This is just a useful fiction for illustrative purposes. So Just want to be really clear about that. So again, the second stage here identifies the nearest 25 cases, and then it uses what it knows about the location and the income values of our blue cases here, and their distance relative to the predicted location, the white dot, and it applies weights from the modeling exercise that we did in stage 1 to adjust the values of each of those blue cases. So each one is going to get a uniquely optimized spatial weight. And then the process is going to blend all of those weighted neighbor values together to create a final predicted value for that desired location. So from a kriging perspective, it applies a uniquely optimized weight based on a combination of spatial conditions. But if you think about it from a census safety perspective, that process essentially adds a uniquely optimized amount of noise to each of those neighbor cases before they then get used and blended together to create that final estimate. Just to be clear, kriging weights are not like standard population and housing weights. The kriging weights they're dynamically produced based on the combination of conditions that you pose to them. They're not a static property of a particular case like you would tend to see it in a household survey. That's not how the kriging weights work. So if you were to crawl in to the census production process and go down and actually look at where all of these neighbors are, you would find these fairly tightly clustered together. In fact, in our test using 100,000 school points, the side neighborhood clusters were about a fifth the size of a census tract. They were even just a little smaller than the average block group size. And again, the best of all is that they can be centered or anchored wherever you want them, because they're not dependent on predefined boundaries of standard census geography. So the final step in the design strategy is to convert the prediction surface into a raster by applying a lattice of 300-meter grid cells across the entire region. This is the entire US. And then we estimate we create an estimate and a standard error for all of those resulting cells. So that's about 150 million complex geostatistical estimates. So that process takes us a while. I'm going to show you another map here in just a second. Again, the caveat, just like before, it's going to have very small geography. It's going to have numbers associated with it. Hopefully, if I've done a good job of explaining, you know that that's fine. No need to panic. But ultimately, this is what the underlying raster then looks like. Each of these cells is going to have a cell value. That rasterization process chops up the prediction surface. It uses the same modeling approach to create estimates for the center points of these cells. And once we've done or created those model estimates and put them into a rasterized format, then NCES can join geocoded point sets to this. So for example, we've applied these IPR values to all of the public schools in the country to create school neighborhood poverty estimates based on the conditions that are proximate to that school location. Those are available at NCES right now if you want to go look at them. Likewise, the states and districts can use an assignment tool that NCES has created to develop and create the same kinds of IPR rasters, the IPR estimates for student geocodes. So the other thing I like about this approach is that it lets us take a more careful look at the broader economic context across local neighborhoods in an area. This is the region north of Dallas, Texas. I don't know Dallas economic geography, but I'd be curious to hear thoughts if anybody does. So there's a lot to like about the estimates approach. They're more geographically precise than than standard census geography. They provide the best information available for local, for specific estimates for specific locations. They rely on a consistent number of sample cases for all of the estimates. They've got strong safety features, and the states can use the information to create student and school level poverty estimates as well. There's some key limitations. First and foremost, this process cannot provide an estimate for a population or a jurisdiction. So if you need to know the percent of population in poverty in some particular incorporated place or city, this is not the approach for you. That's not what it does. The goal is for it to identify or create the best possible estimate at a very specific location. Secondly, some legal and statistical boundaries have a very real impact on the distribution of household incomes. Sometimes those boundaries matter, sometimes they don't matter. Sometimes you can see meaningful boundaries with the side data, but often you have analytic questions that need boundaries. Okay, use boundaries. Lastly, the IPR values aren't particularly intuitive, or at least the folks that we have floated them to so far. There's a lot of context involved. A 317 might mean different things in different places. So we've got a lot of ground to cover there. With almost out of time, but let me note 3 next steps that we're working on. First of all, NCES is currently working with some volunteer states to compare these estimates with their free and reduced priced lunch data at the student and the school level. We're looking forward to seeing results on that. Secondly, this is a really processing intensive exercise. So Javier is working on ways to improve the efficiency on that. And part of the reason we want to do that is because we also want to take some steps to improve the model by integrating administrative data into it. But that's a big lift. May's working on that, and that's going to significantly increase the processing load, and we can't have a production model that takes a server 3 weeks to run. So there's a lot of work ahead for us, but there's also a lot of potential to help improve the data landscape for educational research and education programs. Here's my contact information. Feel free to ask questions afterwards or shoot me an email. Thanks for your time.
Thank you, Doug. And up next, I would like to introduce Liana Fox and Brian Glassman from the Census Bureau with their presentation on the supplemental poverty measure using ACS.
Hi, thanks, Kirby. It currently says that it's screen sharing is disabled.
Do we still have CVent support that can help Liana with her screen sharing ability?
Got it. Okay, great. Well, thank you very much for inviting me to present this work. This is joint work with my colleagues, Brian Glassman and Jose Pacas. Here we're looking at the multi-year project that we've been doing, implementing the supplemental poverty measure, which is a more extensive expansion of the official poverty measure, and we're implementing it into the ACS. So earlier last summer, we released a working paper outlining our methodology. This methodology builds very heavily on previous work done by others at the Census Bureau, including Trudy Renwick, but also on what local and state folks have been doing around the country for years, well before census got involved. So we have a research paper laying out our methodology for doing this. We have some tables online that give state level estimates. And most importantly, and I think probably most interesting for the folks here, we have released public use microdata files for 2009 to 2018, and these are available in both SAS and Stata format. I want to emphasize that these are research files, so we expect these to be updated over time as our imputations improve, as our methods improve, as our access to other data increases. So they allow for the estimation of single year state and PUMA level estimates, but we would like to really encourage you to use caution when you're using these. Know that we're in the process of updating these files right now, and we will be re-releasing hopefully later this summer with 2019 data as well, and then some revised data sets. So all of this is available on our working page, our working paper page, but really what we're looking for is feedback. We would love for users to actually use these, let us know where they seem to be working, where they don't. Most of the presentation, I'm going to kind of show you how we've validated this and we think it's pretty good, but we're really basing it off of the CPS ASEC. So we're doing this validation at the federal and at the state level. At the PUMA level, some of this could be breaking down. So that's why we would really like feedback from users. So why did we create an ACS SPM? And I'll talk about what the SPM is in a slide or two. But primarily, this has been a request from researchers around the country. So prior to Census Bureau implementing the supplemental poverty measure in our main survey of the current population survey, annual social and economic supplement, CPS ASEC, we had researchers working on creating their own version of the SPM in California, in New York City, Wisconsin, throughout the country. But other researchers just didn't have the bandwidth. They didn't have the bandwidth to actually produce this at their level. If they wanted to do comparisons across cities or states, they wouldn't have the capacity to do that. So they wanted one source from the Census Bureau. As you all probably know, ACS has a much larger sample size, which allows for single year estimates at the state and sub-state level, also allowing for single year demographic estimates. So we could actually, using the ACS, look at child poverty in Missouri, which we couldn't do in CPS ASEC without doing at least 3 years of averages. So just a quick overview of how the official poverty measure, or OPM, differs from the supplemental poverty measure, or SPM. So OPM is focused on when you look at the resource sharing unit, so who in a household shares resources. They focus on the family, which is defined as individuals related by birth, marriage, or adoption. SPM expands that to include cohabiting partners and their relatives, also includes unrelated children and foster kids in the unit. The thresholds are very different between the two. OPM has an anchored measure set in 1963, updated for inflation. SPM has what we call a quasi-relative threshold. So it's based on a bundle of food, clothing, shelter, and utilities expenditures, and updated using the rolling average. So as that bundle changes over time, the thresholds change as well. Most importantly here is that the thresholds have adjustments for differences in housing costs. So there is a different threshold for poverty in New York City than there is in rural Mississippi, unlike the OPM, which has the same threshold throughout the country. And then finally, the definition of resources is much more expansive in the SPM. So in the OPM, we have just gross pre-tax cash income. As we know, the way our poverty system works, anti-poverty programs are really focused primarily through our tax code and non-cash benefits. So thinking about EITC and supplemental nutrition assistance programs, those are some of the largest anti-poverty programs, and those are captured in the SPM. So SPM starts with cash income, adds in non-cash benefits. This is nutritional assistance, this is housing subsidies, energy assistance, and then subtracts out income and payroll taxes, adds back in EITC and child tax credit, subtracts out work expenses, childcare, medical expenses, and child support paid to other households. So there are a number of reasons that we would expect poverty measurement to differ between the ACS and the CPS ASEC. First, there's the different reference periods. So ACS is looking at the previous 12 months, whereas CPS ASEC is looking at the previous calendar year. There's some differences in residency rules, where you usually live versus where you live at the time of the survey. In our paper, and so all of our analysis is really focused on the public use data, because we wanted to, our main goal is to get out these public use data sets for researchers to use. So we can't separate, in the public use ACS, we can't separate out institutional from non-institutional group quarters, so they're all excluded. And there's much less detailed income reporting in the ACS. We ask about 8 income questions compared to over 50 in the CPS ASEC. And also there's much less detailed relationship pointers. So we use IPM's methodology for assigning relationships, but it does make it harder to identify, especially unrelated subfamilies, because in the ACS, we only know relationship to the householder, not relationships within the unit in terms of parents or spouses or partners. Okay, so this is the slide that I want you all to look at and say, I need to use some caution when I use these data sets. So we have to do a tremendous amount of imputation into the ACS because the ACS is such a larger sample and we're really focused on reducing respondent burden. So we don't ask all these additional questions. In CPS, we're asking a lot of questions about incidence, like did you receive this benefit? And if so, how much? In some cases, you can see we allocate values to families and we have our own tax model. In the ACS, we have to impute both incidence and amount. So that's where we should use some caution. And some of these values, I think we have more confidence in our ability to impute them. Some are much more difficult to impute. Specifically, I'll talk about medical expenses and childcare because those are very difficult to understand who is actually using childcare, even if you have a household with all adults working and children under 5, they could be using family care or some type of other unpaid care. Same with medical expenses. We don't have information about chronic illness or anything like that. So we are imputing based on the characteristics that we can observe in the 2 surveys, but there's reasons to view those with some caution. Okay, so to talk a little bit about the results, here you can see this is the showing the official poverty rate for ACS versus CPS. And you can see across, we have higher poverty rates in ACS overall and by age group. And when you look at the SPM, we see this similar pattern where there's higher poverty rates in ACS than in CPS, with the one exclusion being 65 and older, which is not statistically different. If here we're comparing within the ACS, the SPM rate versus the OPM rate. And you can see in the clear bars what it looks like in CPS. And we find generally the same pattern where the overall poverty rate using the SPM is higher than the OPM overall, and for adults 18 to 64 and 65 plus, while for children under the age of 18, the SPM rate is lower than the official poverty rate. And that's because the nature of the programs that we're including in the SPM, like EITC and SNAP, are primarily targeted to families with children. So this is what reduces their poverty rate in the SPM. If you look at the trends over time, this is the data that we'll be releasing shortly. You can see that ACS SPM is consistently higher, but it's the same general pattern as what we see in the CPS. Here, these are just kind of some figures showing you some of the validation that we've done, looking at the marginal effects. So this is the percentage point decrease in poverty due to this program. And here we're comparing ACS and CPS, and we mostly want you to see that they look pretty similar in terms of their anti-poverty impact. The one difference being Social Security, and that is because the question is slightly different. In CPS ASEC, we have a number of follow-ups, so we try to get at the gross Social Security, adding back in any Medicare premiums that individuals might have deducted from their payments. In ACS, the question is just how much did you receive, and we don't make any adjustments. So you can see that there's a smaller anti-poverty impact of Social Security in ACS than in CPS. Here you can look at the subtractions that we do. This is federal income tax, payroll tax. And here you can see that work expenses, which also includes childcare and medical expenses, are the areas where our imputations are producing slightly different anti-poverty impacts. So while we are able to match aggregates, we're able to match conditional receipt rates and conditional medians, who they're exactly going to slightly differs between the 2 surveys. Here you can look at some of the marginal effects by programs, and this is really just highlighting some of the uses that you could do, and you can do this for your state, and I'll show you some of the maps that we can create. But you can see how EITC and SNAP are much more important anti-poverty programs for children, while Social Security, which is on a completely different axis on the right, is a very large anti-poverty program for individuals 65 and older. Now I just wanted to show some maps of what this looks like and what we can do. Like I said, the really nice thing is that we can do single year state estimates with ACS SPM. So here you can just look and see the areas of the country that have higher poverty rates, which we see typically is the South, but also the coasts. And these can be for different reasons, because California and New York have higher poverty thresholds, while the South has lower levels of income. Here we can look at, here we can look at the marginal impact of SNAP. So some of these maps I think are really interesting because you can say where is SNAP making the biggest difference, and you can see in these states, the darker states, primarily in the South, but throughout, we can see those are the states most impacted by SNAP benefits. Here, I think this is one of my favorites. This is looking at EITC, and really where we see EITC having the largest anti-poverty impact is in the South. And we could do the same thing with medical expenses. So one of the benefits is that we can also look at this by PUMA level. But as I said, this is an area that we certainly need to do more testing, and we certainly need external users to look at this and help us validate. So we can look in like the New York City area and say, okay, it looks right that SPM rates, poverty rates for the Upper West Side seem considerably lower than the Bronx. That seems legit. But when we're getting into like the program impact of SNAP in certain PUMAs, this is something where we need more research, more external validation. So for our next steps, so we've made, as I mentioned, we've made some improvements to our medical expenditure and childcare expenditure imputations. So those will be released shortly. We'll be releasing these updated files throughout 2009 to 2019. One of the main things that we are working on is correcting for underreporting. So we know that these non-cash programs are substantially underreported in CPS ASEC, and so we're not doing any corrections for underreporting in what we've done here. So we're imputing that underreported data into ACS. So as we continue to move those projects along, we will be implementing that as well. And then finally, we just need to do more to examine some differences at the PUMA level. And so we'd love any feedback or suggestions that any users have. And here's my contact. So thank you very much.
Thank you, Liana. Up next, we've got Lisa Manzer and Karen Segar with a basic needs budget approach to counting poverty with the American Community Survey.
Great, thank you so much. That was a really interesting presentation, and I'm excited to learn more about that. So I'm Lisa Manzer, Director of the Center for Women's Welfare at the University of Washington, and I'm presenting here today with Karen Segar, who has collaborated with us over the years as a demographic consultant. Throughout our work, we use ACS data really extensively, but today we're going to focus in specifically on how we use the ACS data for measuring the number of households that have inadequate income with our basic needs measure called the Self-Sufficiency Standard. So let me introduce that a bit. So the standard was developed back in the mid-1990s by Dr. Diana Pierce, who was the founder also of our center. So what was happening was federal job training programs were being deemed successful as participants were exiting with incomes above the poverty guideline. That's what was being used to evaluate these programs. But ultimately, women, particularly single mothers, were still experiencing high rates of hardships after exiting. Their wages as typically typists weren't sufficient to cover the cost of groceries, rent, and childcare if they're in the workforce. So in the response, the Dr. Pierce was tasked with designing a new performance measure with the goal of self-sufficiency. And the new measure, it needed to be realistic and detailed, reflecting actual costs faced by working families, with the goal being that this new measure would set an income benchmark for training programs that would not leave mothers still experiencing hardships despite being in the workforce now. So the resulting self-sufficiency standard, we take a market basket approach to calculating the cost of each basic need individually, designed for it to be at a minimally adequate level. Costs are estimated typically at the county level and vary not only by the number of household members, but also by the ages of children, which is particularly important for childcare costs. So let's look specifically at an example of what that end data looks like. So this chart here is for a family with one adult and one school-age child across a few different areas geographically. You can see that the overall monthly resources needed for this family type in Wichita comes out to be about 3,000. But over 5,500 in Los Angeles. And, you know, combined housing, childcare, and food is more than what we estimate the income need would be for this family type in Wichita. I also want to note that, you know, if you look at this, the food cost ends up typically being about 9 to 15% of these household budgets. And that's much less than the 33% assumed in the methodology of the official poverty measure. So, you know, once we have a self-sufficiency standard calculated for a state, the next question is, how many households are above and below the standard? This is where the detailed data that we're able to get from the ACS has become so useful. It provides advocates, program managers, policymakers with a sense of the extent of households that might be at risk for hardships, that might need program assistance to lower their costs, change their costs to get them into having adequate income. So that was a quick overview of what our income benchmark is, but I'm going to pass it along to my presenter, Karen, to share the methodology and our findings.
Thank you, Lisa. So using the public use microdata sample allows us to adjust households to align with the assumptions in the self-sufficiency standard. So since the standard estimates the cost of living at a basic needs level for working families, we remove household members who are not expected to work. So that's seniors as well as adults who are identified as having work-limiting disabilities. And so we remove them from the count of household members, and we also remove any income that they have from the family's total household income. And since we assume that all persons share resources, we also exclude group quarters. Then once our new households are defined, we code each one with the appropriate annual self-sufficiency standard based on their location and the number of adults, as well as the number of ages of children, the number of children and their ages. So they're divided into school-aged children and preschool children who are likely to be in daycare. And these family types are actually quite detailed. There are over 700 of them, varying with up to 10 adults and up to 10 children, and then a catch-all category for families larger than that. So on our next slide, so the issue that we confront here is converting the standard, which is generally measured at the county level, to align with the public use microdata sample, which is measured at the PUMA level. So the PUMAs are public use microdata areas, so defined by the census to have at least 100,000 people in order to ensure privacy in the microdata that's released to the public. So in less populated areas, a PUMA may include more than one county, and in more densely populated areas, you'll have several PUMAs in one county. So in order to align the standard geographic areas with the PUMAs, we use the Census PUMS equivalency file, which provides population counts for all geographical areas within a PUMA, and then we calculate a weighted average that we apply to the self-sufficiency standard income benchmark. So here we have a couple of maps, and on the left, that shows income inadequacy rate measured by the standard. And on the right, we have it by Puma. So you can see a lot more detail in the Puma map. And because we don't measure the standard at that level, it gets sort of averaged out into the larger areas on the left. So finally, we compare the adjusted household income to the self-sufficiency standard and create a simple assignment of having adequate income or having inadequate income. And likewise, the same coding is repeated using the census poverty thresholds, so we can compare them. So let's now look at what we found completing this analysis. And I'd just like to mention that the states will be presenting are sort of a convenience sample, because we don't calculate the standard for every state every year. We do it on a contract basis with partners. So these are the states that we have available. And we also don't do the demographic analysis every year for every state. But this is an assortment of our most recent states available. And so you can see that the poverty level doesn't have a whole lot of variation in it, while the standard varies from 21% income inadequacy to 36% in California. And then when we go to the county level, you see a lot more variation in both the federal poverty level and the self-sufficiency standard. So if you look at Kansas, we've got nearly double poverty and income inadequacy between Sedgwick County, where Wichita is located, and Wyandotte County, where Kansas City is. And in New York, Niagara County, which is in the west, and Queens have similar poverty rates, but very different rates of households with incomes below the standard. Only 18% in Niagara versus 34% in Queens. In Pennsylvania, we have highlighted the very high poverty and income inadequacy rates in urban Philadelphia, contrasted with a suburban county bordering Philadelphia. So the cost of living is a bit higher in Montgomery County, but with much lower income inadequacy rates because people who live there have higher incomes. And in California, we have contrasted two urban areas with Imperial County, which is a rural area. And San Francisco, even though it's one of the most expensive places to live in the United States, it has a much lower income inadequacy rate than the rural counties. So in our next slide, we have a map of Washington State. This is the standard calculated for 2013. And you can see that the higher income areas doesn't necessarily mean that there are higher income inadequacy rates. So this map is kind of like the California story, where the Seattle metropolitan area is the most expensive in Washington State, but also has the lowest percentage of households with inadequate income. Meanwhile, Eastern Washington is much more affordable, but since the wages are lower, income inadequacy rates are much higher. The poverty threshold tends to overestimate the resource needs of single persons and underestimate those of families, especially those with young children. Using the standard accounts for the impact of childcare, as the poverty threshold doesn't vary by ages of children. This impact is particularly exaggerated with California. While 26% of households without children are below the standard, the rate increases to nearly half when children are present. And isolating just households with at least one child under 6, the income inadequacy rate increases to 57%. As the standard is an income benchmark that applies to an entire family for variables such as race, ethnicity, or citizenship, we look at the status of the householder or reference person, typically the person who's filling out the survey. And Latinx householders are coded as Latinx regardless of race. So we also consistently find differences in income inadequacy rates between the standard and poverty threshold when examining income inadequacy by race and ethnicity of the householder. While Black householders have higher income inadequacy rates using the poverty threshold as the income benchmark, when we switch to the standard, we find that Latinx-headed households have not only higher income inadequacy rates than Black-headed households, but substantially higher income inadequacy rates overall. And this difference is typically explained by the greater average number of children in Latinx households. For example, in Kansas, over half of Black households do not have children, while 59% of Latinx households have at least one child. And this slide illustrates the impact of how using the standard over the poverty measure can give us a different perspective on the change in income inadequacy over time. So the percentage of households in California with inadequate income, according to the poverty measures, showed a slight rise during the recession and then returned nearly to pre-recession levels by 2019. The percentage of households below the standard, however, increased more steeply during the recession and have remained higher than pre-recession levels, despite an unemployment rate at or below what it was before the recession. Our research has found that families with high rates of income inadequacy going into an economic downturn, particularly single mothers and people of color, were more vulnerable to the effects of the Great Recession. So I'll turn it back to Lisa to talk about how the standard is used.
Great. So that just gives us an idea, an overview of what we do with that data. And I just want to quickly conclude with some of the ways that we model. So, one thing we do is also look at changing of the costs or changes of income and seeing what effect that could have. So when New York City expanded their pre-K program, we were able to do a test on that and found it, changed the number of households by over 5,000 that were experiencing, that were being measured as having inadequate income. And right now, what we're doing is looking at how the impact of the American Relief Plan Act, tax changes, the child tax credit changes, the premium tax credit subsidy chart changes there, how those policy models, what sort of impact those could potentially have to these data sets using the ACS. And then finally, I just want to touch on ways that we provide tools to our partners for exploring the data. So by integrating the output from ACS into Tableau, that helps allow users who might not be so comfortable navigating a basic table, explore the data more, give it a deeper dive. So on the left, we create a map for California, showing how the income inadequacy rates vary across the state. And then we also provide, like a drop-down box with a bunch of variable options, so users can explore it some more. And you can, in a tooltip in Tableau, you can provide a lot of additional data points, and that just it becomes a really helpful tool for advocates and program managers and policymakers looking to see what the needs might be in their areas. So finally, we just, look forward to hearing any questions you have. And, you can get Self-Sufficiency Standard data on our website, selfsufficiency.org. Thank you.
Thank you, Lisa, and thank you, Karen. We've got a lot of good questions coming in. Just as a reminder, please feel free to use the Q&A section on the Attendee Hub to submit any questions that you have. A few folks have asked for some resources, so I know that we're also dropping those in the chat as well on the Attendee Hub with a few links to some additional things that might be of interest to you all. And so now for our last presentation, certainly last but not least, please welcome Brian Glassman to walk us through his work on Census Multidimensional Deprivation Index.
Great, thank you, Kirby. Okay, so as Kirby mentioned, I'm going to be talking about the Multidimensional Deprivation Index. So far today, you've seen 3 different measures of poverty or how to identify people who are impoverished. I'm going to present you with yet another one. So if we can move on to the next slide, I can give you just a little idea of what multidimensional deprivation is. Basically, the idea is there is a cumulative effect of both income and non-income based deprivations. Right? So far today, we've focused on income poverty. I'm going to be bringing in some other elements that people may be deprived in, and I'll go into that in a little later slide. But basically, this is just a more expansive view of well-being than maybe an income-based poverty measure. So why am I talking about this? Well, 26 countries, as of 2020 at least, were using multidimensional measures as their official measure of poverty. And it's actually a United Nations Sustainable Development Goal to reduce poverty in all its dimensions. So this is something that's started to get a lot more traction, especially in the developed world, but more and more so in the, or in the developing world, I'm sorry, but more and more so in Europe and the US. Okay, next slide, please. Okay, so the Census Bureau released its first report in the spring of 2019, and it included 6 dimensions, as I'll define in a second: standard of living, education, health, economic security, housing quality, and neighborhood quality. In presenting this and in sharing this with others, the biggest feedback was that neighborhood quality, which was measured at the county level, and this was just too large, right? For maybe some small counties, this could be constituted neighborhood, but really it's just masking a lot of heterogeneity within even medium-sized counties. So that's one thing I wanted to fix. And secondly, there was just some revisions that I'll talk about in a second that for some of these other dimensions that might not have been adequately measuring what I was trying to capture. Okay, next slide, please. All right, so the purpose of this paper, basically 2 very related ones. First, just revising 4 of the 6 dimensions of the MDI, and then providing revised estimates, and then providing new estimates, because this was released in 2019, but the latest estimates in the report were through 2017. So I will have new MDI rates for those 2 years. The data, okay, 1-year American Community Survey, I don't really need to tell all of you about that. I also, along with this, to measure neighborhood quality, I used the Area Deprivation Index, which is also uses ACS. It's at the 5-year level, but it's an index of 17 socioeconomic indicators, and is created by researchers at University of Wisconsin-Madison. If there are questions, I can go into more about what those 17 are, but basically they're in these big categories that I've listed here: education, employment, income, and so on. And it basically ranks block groups, so it's at the block group level. And they're ranked from 1 least disadvantaged to 100 most disadvantaged throughout the country. The method I used is the Kair Foster method, and basically all this is you calculate how much, or whether people are deprived in individual dimension. You count up the number of dimensions, and then I just define my MDI as the percent of people that are deprived in at least 2 dimensions. That's used throughout the literature too, is generally what people use to define multidimensional poverty or deprivation. Okay, next slide, please. All right, so there's, I know, a lot of information on this. I'm just going to kind of go one by one. Standard of living in the original report. So the first column is where it says 2019 census report. That's the original definitions. The second column is where I have my new definitions. Standard of living didn't change. It's just, are you in poverty according to the official poverty measure? Education is based on your person's at the respondent's education level, if they're, or respondent, or the person in the household's education level, if they're age 19 or older and they were without a high school diploma or GED. It's based on the householder's education level, if they're older than, if they're younger than that, because they may not be finished with their education. And those two did not change in this current paper. For health, ideally we would want like some kind of health status. That's not available in the ACS, but I used in the census report a predicted health status that was based on age and disabilities, predicting from the CPS. This was changed for a couple of reasons. One, in doing research, well, I had health insurance listed in economic security, as you can see from the next row, and I wanted to kind of move that up into health, partially because there is a lot of research that people who lack health insurance avoid seeking preventative health care and actually have worse health outcomes. So I use that as a measure in the current paper. However, people 65 and over, nearly everyone has health insurance. So for that, I made it a little simpler. Rather than doing this predicted health status based on disabilities, I just looked at if you reported at least 2 disabilities, then and you're age 65 and over, then you're considered deprived in that dimension. For economic security, that was changed because, as I mentioned, I moved health insurance to health. Unemployment was kind of a bit of a high bar, since you basically had to be unemployed at the time of the survey and not work for the prior 12 months. That's kind of a high bar to reach. And so instead, I basically created these 2 different categories for under age 65 and over. So under age 65, if you were over age 18 and you were unemployed, you were considered deprived. Or if the average household hours worked or average household weeks worked were basically part-time, less than 20 hours a week or less than 26 weeks a year, then you were considered deprived. And because a lot of people age 65 and over were not working, if you had that, you also had to have minimal retirement income, which was defined as Social Security plus supplemental security income plus retirement income, if that was less than the minimum Social Security benefit, which in 2019 for the household in 2019 was somewhere around $10,000. For housing quality, I had a lot of conditions originally. I got rid of complete kitchen and complete plumbing because we have found that where we can't really separate people who are poor and don't have complete kitchen and complete plumbing and people who are living in like expensive retirement homes where they don't actually have kitchen and plumbing in their room, but we don't want to be describing those people as being deprived. So that we took out, or I took out. And then high cost burden was basically based on percentage of your income that you're spending on housing costs. But because basically in my standard of living measure dimension, I'm already talking about income, I kind of wanted to not have a second measure of income in my measure of housing quality. And so basically I'm just looking at overcrowded housing, which is defined as living in a housing unit with more than 2 people per bedroom, or if you live in an emergency or transitional shelter. So if you fall into either of those categories, you're deprived of housing. And then finally, I mentioned about the area deprivation index. It's that index of 17 socioeconomic characteristics. Those block groups are defined throughout the country from 1 to 100. If you are live in a block group with an ADI score greater than 90, you are considered living in a deprived neighborhood. Okay, we can move on to the next slide. Okay, so I just wanted to do a quick aside on neighborhood quality, and I'm saying this because in most studies of multidimensional deprivation, neighborhood quality is not included. Mainly, they're focused on family level, individual level, household level characteristics. What's different, unique about my measure is that I include neighborhood quality, and I think this is important for a number of reasons. One, there's a bunch of research about among people in poverty. People who live in wealthier neighborhoods, even though they are actually impoverished, have better outcomes. There's also a negative effect for people living in deprived areas. So whether they're in poverty or not, if you live in a low income area, there's worse outcomes with respect to earnings, education, health, crime involvement, other life outcomes. And then finally, for the Moving to Opportunity project, Moving to Opportunity Project was a big study, and a lot of papers came out of that. And they found that moving to lower poverty neighborhoods, among other things, led to improved college attendance rates, improved adult physical and mental health and subjective well-being, lower poverty rates, increased safety and health. So for all these reasons, I think it's very important to include some measure of neighborhood quality in these kinds of measures. Okay, next slide, please. All right, so basically what I'm going to do is get to the results. I'm just going to briefly talk about the comparisons of the new estimates to the old estimates, and then move on to some other things you can look at with these results. All right, so this is looking using 2017 data because that was the latest estimates produced in the report. And basically the star means that the rate is higher in either in one of the methodologies. So if on the far left is the MDI, and so the current MDI is higher than the census report MDI. Standard of living education weren't changed, so of course those are no different. And then you can see from the other dimensions, health and economic security were significantly higher in the current MDI, whereas housing quality, neighborhood quality decreased, changing to this new methodology. In my paper, I go through a lot more looks at like demographics and state and to see how those differ, but for time, I'm not looking at that in this presentation. Okay, next slide, please. Okay, so from this point forward, I'm going to be looking at mainly at 2019 data. I do an over time section where I look at 2010 to 2019, but from here on out, I'm just using the updated methodology from this new paper and focusing on 2019 data. Okay, next slide. Yeah. All right, so this just is looking at, well, I said 2019 data, but this is looking at just the change from 2018 to 2019. And again, the star means that that particular year was significantly higher. So what this says on the far left, the MDI actually decreased from 2018 to 2019. If you look by dimension, you can see that the standard of living, education, economic security, and housing quality all decreased in 2019. However, the health and neighborhood quality actually increased. And next slide, please. All right, so I'm going to do some breakdowns by different demographic groups, starting with age, and compare to the official poverty measure. Right, so overall, the MDI is higher, 14.9% in 2019 compared to 12.3% for the official poverty measure. However, it's kind of similar to what Liana presented with the SPM. The MDI is higher for age 18 to 64 and for 65 and over. However, it's lower than the MDI for people under age 18. It's lower than the OPM, sorry, for under age 18. For race and Hispanic origin, you can see the MDI is actually higher than the OPM for all racial groups except for white non-Hispanics. And there's small differences for Blacks, there's small differences for Asians, AIAN is American Indian and Alaska Native, but there's a very large difference for Hispanics. So I'm going to kind of try to delve into that a little bit more in the next few slides. Okay, so why the large difference? This has, rather than graphing the MDI versus the OPM, this is Hispanics versus non-Hispanics. And you see poverty is higher for Hispanics, but by 6 percentage points, not by 12 percentage points. So what is causing this huge difference? Well, you can see there's very large difference in education, large difference in health, and very large difference in housing quality. That's what's driving this large difference in MDI for Hispanics. And then also, I think it's important to keep in mind that Hispanics are not a heterogeneous group, right? These are the categories that we that we break down, or that can be broken down in the ECS. And you can see that, yes, it is true that there's large differences between the MDI and the OPM for Mexicans or people with Mexican descent, Dominican, Central Americans, but there's a lot smaller differences for Puerto Ricans, Cubans, and South Americans. All right, so I don't have a map here, but just kind of give you an idea of the state differences. It ranged from a low in New Hampshire 7% to a high in Mississippi of almost 24%. And just a reminder that the overall rate was 14.9%. And it kind of varied by state. So it was higher than the OPM in 29 states, but it was actually lower than the OPM rate in 8 states in DC, and then not significantly different in 13 states. So though overall nationally it's higher, it's not completely the case by state. And then if you look at over time, you can see that the beginning of my time period is 2010. There is, the MDI is higher than the OPM in all years, but starts out in 2010 about a little over 5 percentage points difference, whereas in 2019, we're at about a 2.6 percentage point difference. So they get a lot closer together. You can see it really start to come closer together in 2014. Part of that is a result of having health insurance as part of my deprivation. In 2014 is when the Affordable Care Act mandate kicked in, and the number of people without health insurance decreased pretty significantly. So that's at least part of the explanation for why that's different together. Okay, and just to kind of wrap up, 4 out of the 6 dimensions were revised for this current MDI. I didn't mention this before, but the current MDI is greater than the census report MDI in 2017. I'll mention that. This is true in 21 states, but in 19 states, it's actually the opposite. So about where there's a significant difference, about half the states, the MDI increased, about half the states they decreased, and then in some states, there was no significant. And then finally, what do I plan on doing from here? Well, I'm still more interested in looking at these demographic group differences. There were significant differences, or there were very small differences for certain groups like Black non-Hispanics, Asian non-Hispanics, and very large differences for Hispanics. I'm looking at the value added of a multidimensional measure. I actually have presenting a paper in June, I guess it is, looking at what do we actually get out of this? Who are we identifying specifically that are multidimensional poor or deprived, but not that we were missing or we're not identifying using the official poverty measure. I have started doing some work looking at the relationship between MDI rates and county state characteristics, such as like health outcomes specifically, but also starting to look at maybe some other areas. And then with the 2020 data set to be released in September, I want to look at what the effect is of COVID-19 and the relief packages on both the MDI rates and the official poverty measure, and kind of see what groups are being affected differently by both the rates and by the different demographic groups. And then there's my contact information, and I welcome any questions or comments that you have. Thank you.
Thank you, Brian, and thank you to all of our presenters for all of your wonderful work and sharing everything with us today. We have a lot of questions. I'm not sure we'll be able to get through all of them, but if all the panelists would like to turn their video on, I'll try to hit some from each of the presentations that we saw today. So the first question I'm going to throw out there is for Doug. Doug, the question that came in was how the sample strategy for ACS influences your modeling practices. The person who asked the question says ACS is not a random sample, so the location and density of respondents is not random. With small geographic areas like yours, this could matter. So maybe just more question about that.
Yeah, it's a great question, and we have been exploring that, and we're going to continue. Our initial concern there had to do with like the classic preferential sampling, when you've got a sample that's directly influenced by that dependent measure that you're trying to measure. Fortunately, in the ACS case, that's not the case. We've just got adjustments in the sampling strategy that affect the density, but that's primarily adjusted because of the response rates. So yeah, I'll leave it there. We've been able to explore enough to know, preferential sampling isn't necessarily the issue. Whether there is some sort of a residual impact from the plain vanilla density is another matter. So good question.
Perfect, thank you. And we have a question from Cliff. this question is for either Lisa or for Karen, but how does the self-sufficiency standard discussed here differ from living wage standards published by MIT and the Economic Policy Institute?
That's a good question. There's a lot of similarities across all three of them. The self-sufficiency standard, the EPI and the MIT's all methodology have actually built from the self-sufficiency standards. And it kind of have just like different focus and use. The standard has a more detailed family types. We come out of the creation of the standards focus specifically on training programs. So in the workforce arena, looking at making sure our measure is really detailed specifically for a lot of family types. So when case managers are sitting down with a customer coming in, they're able to have a discussion with them about their specific situation and talk about what their resources are versus what kind of is measured as like a minimum level that they might need, and then start targeting towards what education or training programs might be a good fit. I mean, since then, the standard gets used in a lot of different ways, but that's kind of like really the beginning of it. And so the MIT and the EPIs, they don't have that much detail with the family types, but they do have additional measures that kind of take it beyond that minimum level that might look more like civic, like what you need to be kind of like the next step. And another thing is that they do have their data nationally. So if you are doing like some policy analysis, policy modeling, the EPIs in particular might be helpful for that when you don't need the level of detail that we have.
Thank you. And then I have a question for Brian. Brian, the question submitted here is, were all people living in studio housing, in parentheses, no bedrooms, considered housing deprived?
That's a good question. Yeah, I should have mentioned that. No, if you were in a studio housing or a studio, I considered that you was one bedroom. So you had to have more than 2 people living in a studio apartment to be considered deprived.
And just one more question for you, which was this person asked what are the geographies available for MDI?
Good question. So, I mean, I used internal data, so releasing that, as many of you know, with the disclosure rules that we have, it's only available at the state level. However, I have been working on similar to, I guess it was Lisa and Karen doing the Puma County. I've done a very similar thing to create county level MDI rates using the public use. So I do have county level MDI rates that I presented here that are available.
And then a follow-up question that just came in is, have you considered constructing it at the census tract level?
Considered it, but again, I mean, not using. I think, I mean, one, I would have to switch to like a 5-year ACS data, which is fine, but I think that more of what I'm trying to do is be able to release this data, and it's kind of hard to release at that level. So that's kind of my question and answer.
Got it. Thank you. And I think I missed one for Doug. Doug, this one is about the boundaries of a quote neighborhood. It says, so there are no restrictions at all for the size or boundaries of a neighborhood. For example, could you define the neighborhood by a school catchment area?
Good question. No, you can't. And again, this is kind of going back to the way we define or the way we frame it. It's best to think of those in the raster situation, those individual cell values, those cell values have been informed by information from the neighborhood. So whether somebody could take cell values and collect them together, I don't think that would be appropriate. So again, this is the limitation. It's great if you're looking for an estimate for a specific XY location. It doesn't work if you're looking to, try to put a geographic bound around that. So it's a point-based approach. It works well for that, not so well for other things.
Got it. Thank you. One came in, I think this is for Lisa or for Karen, but it says, how is Manhattan shown as 2 boroughs?
That's a good question. Manhattan, due to the housing costs, we use the census, the housing vacancy survey to kind of look at the distribution of the different rental costs, and there's a kind of a line, and so we split it that way.
Got it. Thank you. And give me 1 second to scan. I think some folks might be putting some questions in the chat. Okay, so I see there are a couple questions in the chat as well. So Doug, got another question for you here. I understand that kriging is what is relatively easily available and is well understood in the literature, but it is a developed and applicable method for stuff that is smooth and continuous in nature. I think that's more of a comment. Something about Krieg being a mining engineer. Okay, not a question. Hold on, let me come back. Unless you want to respond.
No, I mean, if I'm following the comment, it certainly is an unusual application of a method that's used in the geosciences. The fundamental assumption there is that you're working with a geographic process, and we're making the grand assumption that these, socioeconomic conditions are functioning as a geographic process. So that's why we imported it.
Very cool. And I think those are most of the questions. Just going to check to see if anything else came in that was pending. Yep, a few folks definitely had some questions about source files, some data sets, some documentation. So those should all be in the chat. And I think that's it. We have a couple minutes here. So I've got the chat open if in the Q&A open if folks have any more questions. Now's your chance. Speak now or forever hold your peace, but I'm watching those closely. So in the meantime, just wanted to again thank all of our panelists again for all of your preparation for today, but of course all of the work that goes into everything that you've presented today. Very fascinating, and I'm sure that each of you, thank you for including your contact information. If folks would like to reach out specifically to each of our panelists with more questions, I'm sure they would welcome that. So please do so, and thank you all, and please enjoy the rest of the conference and all of the sessions that you'll be attending today. With that, I don't see, oh, never mind, I lied. One more question, a buzzer beater. So Liana, it's how will the SPM account for the resources such as stimulus checks and new refundability of tax credits in the 2020 ACS? So how will you account for those?
So that's a great question. So it's something that we're currently working on in the CPS ASEC. So in the CPS ASEC, we added a question to the survey asking about stimulus payments. Of course, there are going to be some challenges, and we haven't, got all that data yet. We're still in the process of cleaning it. But because I've forgotten if it's the second or the third. So they both went out. Yeah. Okay. So the second stimulus payment went out right on the boundary of 2020 and 2021. So people got them days apart. And so the question, we're not sure how people are going to respond. And then when we were actually in the field collecting the data is when the third stimulus payment went out. So we don't know we don't know what the quality of that data is going to look like until we actually get it. But we're working on some projects in Census to model that. So we can model it using 2020 data fairly easily. Not sure how great that's going to be because it's really based off of their income in 2019, 2020. We're also working on an administrative records project right now to actually link IRS data and export the parameters and use those to kind of estimate how people's AGI in 2018, 2019 is related to their AGI in 2020 and how we can adjust. So once we figure that out in CPS-ASEC, I think we'll be using that same method to apply to ACS as well. But stay tuned.
Very cool. So I'll save everyone from my closing spiel again, but thank you all for your attendance today, and please enjoy the rest of your day. So bye.
Thank you.
Bye. Thanks, everyone.